Good mid-morning, everybody. I'm Dan Seewald, and as John had introduced me, I work for Pfizer, and I actually love talking about innovation, particularly within large organizations. So I'm going to tell you a little bit more about what you might not know about innovation in large companies and give you a little bit more of a look under the hood. But to do that, what I'd like for you to do is have a little participation in this session. So I'm going to ask you guys to do a little projective exercise. I want you to imagine, so imagine for a moment, you're the CEO of a large established company, not necessarily Pfizer, but any large established company, and you're overseeing presentations for next year's budget requests. You're faced with a request between two projects, and you have $1 million to spend. The first project is a long-term speculative endeavor. There is no clear ROI, or return on investment, on this project. It's somewhere far into the future, but it has a lot of possibility to transform. The second is a project for a mature brand. It's well established. It has a pretty short payback, less than 2 years potentially, and it has a well-worn pathway in terms of its return on investment. It's been done before, it's known. So as the CEO, I'd like to ask you, by standing up, if you're very likely to invest in the speculative project, stand up for just a moment, stretch those legs out if you're very likely. I'll give you a moment just because I know our hamstrings might be a little sore. Great. If you are somewhat likely, please stand up. Oh, a lot more people, a lot of people riding the fence. And lastly, if you're not likely at all to invest in that speculative project, please stand up. Who's not likely to invest? Don't look around, just stand up. Very few people. So I'd like to just call this out as a really shining example of what really happens in the corporate boardroom. There are speculative projects that have the possibility of transformation that smash head to head with the things that are ongoing operations in your business. And it becomes a real source of conflict of how do you keep the lights on while at the same time investing in high innovation, radical or disruptive innovation. And that is the challenge that we often face. So you've heard a little bit about me, a couple things I just want to mention since I know a little bit more about you guys and where you stand. Worked at Pfizer. I've been in the industry for almost 20 years. I've worked with hospitals, clinics, but also a number of pharmaceutical companies. Been at Pfizer for about 5 years now. And I've spent a number of years doing commercial development, which is developing new products, new offerings, new ideas to meet the needs of payers, providers, and physicians. What I do today at Pfizer is around worldwide innovation across all 77,000 people in all of our businesses. And it's around accelerating innovation in the everyday, because innovation is absolutely critical for our persistence as a company and our survival as an industry. There are three things that we do: culture and capability. This really builds on the comment from the first presentation this morning, that culture eats strategy. It eats almost everything else. I would agree with that. And we believe that culture and enabling your culture with capabilities is the backbone. Connections, because chance favors the connected mind, inside and outside the organization. We're always trying to foster connections and unique collaborations. And lastly, visionary experimentation. And that's about taking thoughtful risks to try to create those big disruptions and doing it in a stepwise, more experimental way so you reduce the risk while still taking those chances to get those speculative possibilities. So that's a little bit about what I do and what we're aiming to achieve. I want to come back for a moment about the challenge that we just faced, the question I asked you about ongoing operations smashing up against the possibility of transformation and investing in one versus the other. I have a neighbor back in New Jersey whose name's Tony. Tony runs one of the largest black car services in the New York metropolitan area. Third-generation business. It's been running for almost 50 years, and it's been very profitable, very successful. Tony is extremely proud of the work that his family and he has done. When I told him that I work in innovation, he got super excited, and he told me about all the cool things that they do. They invested in GPS for their cars. They started creating this swapping program with mechanics in the tri-state area. Really incrementally cool things that have kept the business running. I know very little about the car service business, so I was really just more or less listening. And then I remembered, I'd read an interesting article in Inc. magazine. This is, by the way, 2010, just as a reference. I'd read this article about this new upstart business that was testing its concept in Lower Manhattan, in which you could flag a car down using your smartphone, and immediately payment would be registered and would change the whole process of catching a taxi or reserving a car service. A total disruption. So I was really excited to tell Tony about it. You probably know what company I'm talking about. Anybody want to guess? Yeah. Uber. Could have been Lyft Car also, but Uber 2010. Uber, I thought, was such a great story, and I thought this was a great way for him to really get ahead of the game. And Tony's smile turned immediately into a frown, and he said to me, Dan, there's two things you need to know about the car service industry. Number one, it's about trust. Number two, it's about relationships. No Uber is going to change trust and relationships. The industry is not changing. So I left it at that. He did tell me that they had a website also, so I thought that was pretty progressive. So we kind of left it there. Sure enough, time passed, and Tony and I ran into each other again, probably about 6 months ago. You might know where this is going. I asked Tony the cliche question, how's business? So Tony said to me, I've been Ubered. It's now a verb, I didn't know that. His business has been declining. Less repeat customers that used to come back to him religiously. Less new customers that he was getting at the same clip rate. Sales are down, profit is hurting, he's trying to figure out what to do. Now, to steal a line from John Hockenberry, what's the takeaway? For me, the takeaway is this. My friend Tony is a very good businessman. He's a smart guy. He's run his business very successfully. But because he's so good at what he does, because he was investing in all the incremental things that keeps his business running, Tony was staring down the barrel of disruption. The future is right in front of him. He could have done something potentially about this, but he didn't. And the reason why is well-managed companies, like Tony's, struggle to be innovative because they're well-managed companies. Now, this may seem very obvious, but for me, this is a big point. Pfizer is not that different than Tony's car service. We're not that different. Well-managed companies are focused on the next quarter and trying to deliver on expectations while also staying ahead of the curve to a certain extent. But there is a strong gravitational pull back to the core of what you do. I guarantee you it's true in your hospitals, in your businesses, it's true at Pfizer. And the question is, what's getting in the way? What stops us from being able to multitask, to do both the speculative project as well as also the ongoing operational stuff? So I'm going to key in on just two things, just in the interest of time. But it's multivariate, to be sure. It is multivariate. But there are two things I think we can get at pretty quickly and do things about. And I'll tell you in a moment about things we are doing at Pfizer to do it differently. The first is business as usual often masquerades as innovation. What do I mean by that? Well, the things, like go back to Tony's example, which he's calling innovation, are not really innovation. They're incremental improvements. They're keeping the lights on. But because we call it innovation, when everything is called innovation, nothing is innovation. And that becomes a challenge because you don't have a meaningful portfolio, a portfolio of innovation that you can maintain. And incremental improvements have become the standby for innovation for most organizations, and they end up weakening the resolve of the leadership of your company. So if you say we're doing a ton of innovation, that's great, but if the innovation is just the basic blocking and tackling, it's not enough. And it stymies the possibility of big disruptive stuff that can bring down the cost of healthcare and transform the industry. The second thing that I want to key in on are the usual suspects. This is a normal lineup. There are many experts and people from within the organization that you work with, and those same folks bring in an entrenched mindset. It doesn't mean they're not talented, that they're not bright, that they don't have good ideas, but when you go to the same well, you get the same water. We need to get out of that well. We need to get into a different river of thinking. So the usual suspects is a challenge that can also stifle innovation within your organization. So what are we doing differently? So there are a few things I want to highlight that we're doing differently that I think really are going to make and are making a difference. The first thing, this may look a little bit like an eye chart for up you there, but I want to just key in on, this is about culture. So we talked about culture right at the beginning. I'm going to come back to it. If you want to change a culture, you have to shift the mindset. The mindset in the organization is focused on incrementalism, usually. So you have to shift the way the organization is thinking. So we have made a pretty large endeavor to do that. A program, a movement, it's really more of a social movement within the organization called Dare to Try. So Dare to Try at Pfizer is an innovation and experimentation program, getting people to think more entrepreneurially, taking more thoughtful risks, and also thinking more innovatively in their everyday. On the innovation side, it's going from a problem, clearly primed and focused problem, to an insight-based ideas. The ideas are based in using lateral thinking techniques. We talked about design theory a little bit this morning, or was touched upon. We use elements of design thinking and creative problem solving to get people to think differently about how we approach problems. The second piece, or the other side of the balance sheet, so to speak, is experimentation, something that in our labs we do well, but on the commercial side of the business, it's not done nearly as well. It's about taking small wagers, scaling them fast or failing them fast, and learning from them. We heard about errors and mistakes this morning and how hard it is to admit that you make mistakes or admitting you have errors and tracking them. Well, it's the same thing with experimentation. We are only going to get breakthrough ideas when we actively experiment and learn from what doesn't work. A la Thomas Edison and all the great inventors and innovators of the past several generations. The way we're making this real within Pfizer to get people to live this is running series of workshops. Now I know my first reaction was like, oh, workshops, but it's multi-level. We train champions or advocates in the organization, and then we take real business problems from the teams within the company. They bring these real challenges, which quite frankly, many people are skeptical and say it's not going to be solved in a multiple day workshop. We teach, we apply, and people see real results. Not everybody comes up with a breakthrough idea. In fact, the majority are incremental. But if 20% of your ideas are transformative or have the potential to be transformative, you have a real innovation portfolio. And that is really where disruption is going to come from. Directly related to this is the idea of thinking outside the normal conceptual borders. We are actively remixing what works from outside of healthcare and pharmaceuticals. Traditionally, when people were looking for solutions to existing problems, we went to, well, what did another team at Pfizer do? What have other people done in the pharmaceutical industry? We're actively pushing our colleagues to look outside of pharmaceuticals, outside even of healthcare, and to see what works and why. An example, just to make this come alive for you, is in the area of smoking cessation. Pfizer has had investments for many years in smoking cessation, both in terms of products, grants, and work that we've done. One of the real stubborn problems that probably is pretty top of mind for many people, if you know or live with or have been yourself a smoker, is it's a very lonely, solitary journey trying to quit smoking. So we tried many different things with mixed success, and we decided to look outside of smoking cessation, outside of pharmaceuticals, and said, where else do people take solitary, isolated journeys? It's a difficult climb where they need support. And we landed on the idea of the New York City Marathon. The New York City Marathon was a really interesting analog because in the marathon, people start their journey, but the New York City Marathon has provided a sponsorship network of friends and family to both financially sponsor, as well as also to provide encouragement and support every step of the way of the marathon, down to the point of tracking them on your smartphone while they're running and seeing what they're doing and be able to congratulate them when they finish. We asked, why couldn't you do that with smokers? Why can you not make it a celebration of something they're doing where they get support from friends and family rather than something that's isolating? So we took that, we adapted and remixed it, and we came up with an experiment in Russia, a very highly prevalent area of smoking, somewhat degree of indifference towards quitting smoking. Difficult place to do it, but we figured if you could do it there, you could do it anywhere. We ran some experiments in Russia, and we found this idea called the gift of quit, where friends and family sponsored the quit attempt of a loved one and supported them through their journey. And we did that by looking at what works outside of our normal domains. I would ask you to think about that for yourselves as well, is what is done differently. If you translate your problems generally, agnostically, and you pull out the possibility or the idea behind it, you will find that there's creative solutions lurking in every category and in every area. Last couple things I'm going to mention. One thing going outside the conceptual borders for ideas, it's another thing going outside the borders of your company. This has traditionally been very difficult in the pharmaceutical industry and other industries. We do partnerships, but the truth be told, people look for their ideas where they're most comfortable and where they have seen them in the past. So if you're looking to solve a problem, you might start right within your company. We're trying to push that thinking with open innovation models, both inside our company and outside. Just to give an example, inside our company, our research and development group was trying to figure out how they might be able to develop a new use of an older medicine to help patients create new value for them. This team wrestled with this idea for quite a while. They came up with very conventional solutions that they had often come up with before. So they said, well, what if we just reached out to all 77,000 people at Pfizer? Let's see what we got back. So they framed it as a challenge, they gave some background, and what they ended up getting back was 116 different proposals. 116, some which really weren't very viable, but a number that had incredible possibility. And what's most fascinating is it came from disparate corners all around the world from our organization, from people who would never have been asked otherwise. And that's where open innovation really can make a difference. Likewise, looking outside your organization as well. Open innovation's been around, the term was coined probably almost, I think, 50 years ago, and people have been practicing, companies from Procter & Gamble, other healthcare companies, particularly in the research and development space. But only now are we starting to recognize that can change our innovation model. And a great example has been in our pharmaceutical sciences teams trying to come up with a new pediatric medicine to make it more palatable for children they wanted to adhere better to their treatment. They tried many things with limited success, and they decided, let's open this up. They put it out on an open innovation platform, and what they got back were a number of really novel proposals, which only now are starting to change the way we're doing things within our organization and are leading to a potential disruption that in the past we wouldn't have discovered. So open innovation opens the doors. Second to last thing I'm going to touch on is the entrepreneurial world. Just a couple of words on it because you're going to hear about it from Jeff in a moment. We believe that we need to find inspiration also from the entrepreneurial world, as well as the corporate world and the academic setting. And we've done that by partnering with different groups like Rock Health, Mass Challenge, Blueprint. These are health tech incubators and accelerators. And what we've done, which has become rather interesting, is bringing our problems to them rather than them in coming to pitch to us. We've created forums like the Entrepreneurs Cafe, in which we get introduced to them, we bring our problems and our challenges, and they start bringing their technologies, their ideas, and their solutions to come up with novel possibilities so that we can collaborate. And it also has the double benefit of infusing the entrepreneurial spirit, which is often lacking in a corporate setting, and changes the way we approach problems and the way we problem solve. Last but certainly not least is the way we're reinventing the traditional partnering model. In the past, if you were going to work with a team of investigators or academic researchers, there was effectively a firewall, segregation between the developments that they were coming up with, and then they would come, do a due diligence, and you'd either acquire the intelligence from them. It was very segregated, very isolated. It was a very linear path. Pfizer has developed a center called the Center for Therapeutic Innovation. It's a separate entity. It's not at Pfizer. They're in 4 locations, right where the researchers are. And what's unique about it is it pairs scientists at Pfizer alongside, literally working elbow by elbow with the researchers at other academic institutions. And we make available to them our screening technologies, our libraries of molecules, all the things that really make a large company like Pfizer very viable are now being put at the disposal of these researchers, and we find an equitable way to work together so that early on you can accelerate ideas and innovations that bring medicines to market faster, more cost effectively, which hopefully in the future will bring down the cost of healthcare and medicines. So I'll close with this. In the past, it was all about how fast you could go. We always talked about being the first to market, the first out of the pack, being the biggest, being the best. But there's an old African proverb you may have heard before. If you want to go fast, go alone. If you want to go far, go together. And I believe that that is really where the solution lies, that we have to go together to be able to create meaningful, disruptive, transformative innovation that changes the game and changes the way we work together and the way we survive in a changing world of healthcare. Thank you very much for your time, and I look forward to chatting with you all.
Let me just say, Dan, lots of people want to chat with you. I'll give you a
I've never been so popular.
Yeah, exactly. First of all, on your quitting smoking thing, how do you monetize that at Pfizer? I mean,
so one way you do it is, well, there are a couple things. The program was driving people towards using products, not just Pfizer products. So if you use Pfizer products, there is some return on investment in that case. But quite frankly, we're trying to drive people towards quitting smoking in general. So we make a lot of unbranded or non-product specific investments because we're committed to smoking cessation as an organization. So the way you look at it, not necessarily monetize it, is how many more people are quitting, how many people are making it through and staying quit. So it's not always monetized. And actually, when we've presented this to our leaders in the past, this program, it wasn't about how much money did we make. So that may disappoint people to hear, but it's not always about a return on investment of these kinds of programs.
Does the FDA approval process cause you to get sort of hung up on the learn from your mistakes innovative strategy where you really need to learn from your mistakes, but if CNBC reports your bad drug trial, then your stock loses 4% of the value if it's an anti-cancer drug?
Yeah, it's a tricky question. Regulation is there for good reason, and I think the more we partner with the regulators and we understand what they're looking for early on in the trials, then you're going to have less likely to have disappointment, but you will still have disappointments, the nature of the beast. I go back to the point about going together. The better we understand the regulators, the better we can work with them, the more likely we are both to be successful. It may sound cliche, but I really do believe that. And we've seen that when you design trials, if you know what they're thinking early on about what gives you the best chance to create a meaningful medicine, stuff that could be disease modifying, you're going to design your trials differently based on the input you get from them. If you're waiting and you're playing the game of what is the FDA going to say, and God, I hope they say it's okay, you're in a bad position. And that's starting to change, but some of that's a resource issue, as much from the government, the FDA, as it is from our organizations.
Although phrases like work with the regulators can sound a little scary in the sense that you're maybe paying off the regulators. I mean, if you get too cozy with the regulators, then suddenly it looks like a conflict of interest. So there's that problem.
Yeah, you have to. There has to be a delicate balance. You're right. But I do think that it's very necessary to have this sort of dialogue with the regulators. It shouldn't be an us versus them mentality. I mean, it's a total tangent, but isn't that the problem right now with our political system right now? It's very much, red state, blue state. There's an us versus them mentality, and we do see that when you can have a dialogue, it changes the game. It really does change the game.
All right, here are some questions here that I want to give to you from the audience. Some of them are kind of tough. What are you doing to dent the healthcare system? Who are you investing in? Your presentation feels like a pitch. How do you respond to that?
There is no pitch here. So, you know, what I would say is I'd hope that people take away from it, there's a lot of different ways to be able to innovate and change your business. We're constantly challenging ourselves to ask, how do we do things differently? Because we recognize that the healthcare system, the pharmaceutical industry is evolving. There's a lot of problems with it. It's fraught. So we have to be really very vigilant about what we do and really challenge everything that we've done. So what I would say is that, you know, this is what everybody should be doing. You should, you know, if your institution is not doing this, if you're not challenging yourself, if you're not looking outside your own conceptual borders, then you're also going to have a lot of problems existentially as well as an organization.
But isn't Pfizer's business basically coming up with the next molecule that will clear coronary arteries or make, you know, erections last longer or, you know, deny blood to a metastatic cancer?
That our business is developing new molecules, you're right. But what I would say is there's more than just the drug. There's everything that goes around the medicine as well, and that's a big part of what we also work on as well.
How does Pfizer manage the innovation process, someone asks? Usually ideas require people to work on them and manage the process. This often means for more work for an already stretched staff. How are you able to create balance the old work with the new work?
Yeah, so that's a good point about the old work versus new work. So we take what was the old work and we look at it differently. So actually, just to give a quick example is that we're working with a team in oncology, cancer, and they were really struggling to solve a problem. And they said, we don't need to do a workshop. We don't need more work. We're already stretched. Heard that exact comment. And we asked them, well, what would be the harm in taking a couple of days to learn something new and approach the problem in a different way? They came in very skeptical, and they took their old work, their existing problem. We taught them new ways to do it. We have a champion or somebody that's working with them to help guide them. And they've actually come up with some pretty disruptive ideas. And this was something which they completely did not expect. And the truth of the matter is that when the old work becomes in addition to innovation, it's not innovation work. This is just a new and you know, a new campaign or a new program. So we try to take what people really are working on and make that the problems that you're solving for.
What is Pfizer doing to stop the pay-to-delay tactics that stiffed innovation over the past decade? Do you know what he's talking about there? Or
I couldn't really comment because I'm not well informed enough on that. So. Sorry.
In an institution with high turnover rates, how do you select members who have a good understanding of the organization's strategic thrusts and visions, and yet are still able to push concepts that are relevant to the organization? In other words, are there people who are better at innovation and worse at innovation who have responsibility within the company?
Yeah, so you're not going to have 77,000 amazing innovators.
Boy, would that be annoying.
Yeah, then we would be a startup company.
Yeah.
It's a great question because people have come out and said, I'm not an innovator, and we believe it's a bell curve. There are some people who truly are not, you know, wildly innovative, but they have some potential. But the most important part is it can actually be a part of the process and not be a derailer and contribute. But probably more important is identifying the people who are the accelerants, if you will. And we've actually been trying to identify those people who want to be involved. They work with the teams. There are actually a number of people at Pfizer that give up, in addition to their day job, which could be many, many hours, they're actually working tirelessly on other innovation projects for other teams where they have no vested interest because they want to be a part of this. And there's no outward incentives. We're not paying them. There's no cash transfer for it. This is really about intrinsic motivation. And it's finding people who really care about it and love it. And there are a lot of people who are incredibly passionate here. I bet if you had the opportunity in your institution to do something like this, you probably would invest emotionally and also time-wise, so you would find it. I find myself working on Saturdays and Sundays on things because I love what I do. I love what I do every day, and I come to work looking forward to the challenges of it. And there are other people at Pfizer like that, so we dive into it.
As a corporation, and this is the final question, as a corporation, does Pfizer have an intrinsic interest in research and development for antibiotics, knowing that, as you say, innovation holds the promise of reducing the cost of healthcare, but it depends on where you measure that cost. In the long-term view, the development of new antibiotics could reduce the cost of healthcare, but in the short term, antibiotics are not necessarily a good investment. What's the interest on the part of Pfizer to develop new antibiotics?
Yeah, unfortunately, I couldn't tell you the precise research and development agenda. I do know at the Center for Therapeutic Innovation, they had spent quite a bit of time working in the anti-infective antibiotic space. Whether or not that will end up becoming part of the Pfizer portfolio, I couldn't really tell you. But I do know, just as an industry, that we do have a vested interest, along with the public health community and healthcare in general, to have new antibiotics that are being developed and that end up being placed in the wards in our IDs. So it's particularly important, but I couldn't tell you if it's part of our high agenda. But there are many companies that are focusing on it in the pharmaceutical industry.
Dan, thanks so much.
Thank you.
At the Meet the Speakers, a lot of people have more questions.
Great. I look forward to it.
Yep.
Thank you.